So as we begin this presentation, where I'm going to predominantly be focusing on how some of us who were trained by Sogyal Rinpoche in meditation over a number of years began to take these methods into organizations and work with staff, with the people who were actually doing the caring. I would like first, though, to invite you to join me in actually becoming present, and to invite you to become as present as possible for the next 30 minutes. So we'll do that using a very simple meditation, which is based on the methods that Sogyal Rinpoche has introduced to us over a number of years. So just to first of all say, if you normally meditate with your eyes closed, you might like to try doing this with your eyes open and see how that goes. And we also encourage people, if possible, to have your back straight, but not rigid, not like you're at attention, but just because that enables you the energy in your body to flow better, and it actually helps your meditation. If you're feeling your mind is quite busy, then just look down in front of you. But if you're feeling a bit sleepy, and it is after lunch, so you might be, then look up. There's a wonderful example here of a sitting meditator that you can use to inspire yourself. So we're going to do this in 3 steps, 3 simple steps. Yesterday, Rinpoche said, "We are scattered everywhere, and nobody is at home." So bring your mind home. Just allow all your scattered thoughts to come home. And just become present, not thinking of the past, nor anticipating the future. And as you do this, have a sense of welcome in yourself, a sense of coziness. A sense of being here now, in your body, feeling your body on the seat, and feeling the coziness of that, the welcome of that. Second step, release. Release any holding or tension that you feel. Just simply letting go, in the same way you might let a clenched fist go. Just letting go of any tension as you breathe out. On the out-breath, let go. And as you let go, just give yourself space, a sense of spaciousness, allowing a sense of openness. Step 3, relax. Just letting your mind settle naturally welcoming whatever you find there in your mind, like a gracious host who welcomes all the guests, gives each one perfect attention, but doesn't spend too long talking to them, moves on to welcome the next guest. Just ease into your natural self, your natural mind, the radiance of your fundamental nature. And if you can, just leave your mind quietly in a state of natural peace. And just take a moment to just check in with yourself now. How does it feel to be like this way of being? Does it feel natural? Does it feel like a way you would want to continue to be in your life? Thank you. I really feel you doing that with me. It helps me, even if you didn't get much from that. I got a lot from it. Rinpoche has said many times that meditation is not getting used to it is. And this is very much this practice that we bring from the Rigpa tradition is of naturalness, of getting used to meditation. It's almost like we just infiltrate it and gradually people find they're doing things a bit differently. So, my own background in meditation is that I studied first with a Theravadan teacher, then with a Zen teacher, particularly studying the Satipatthana Sutra, which is where the mindfulness training has very directly come out of. And then for 30 years with Sogyal Rinpoche and this particular tradition. And more latterly in Rigpa, we've been developing something called the Spiritual Care Program, which has taken the methods that we have been learning over a number of years and begun to address how to take them into organizations and into health services and work with healthcare professionals. And it's those methods that I'll be drawing on today. We know that there have been huge changes in the West, that as we've been able to address poverty, illness to some extent, then actually we've begun to look at how we can increase more contentment and happiness for people. However, when we are caring for people, we still need to address their misery and their suffering. And in fact, there's a teacher called Samdong Rinpoche who's been here to Larabling, and he wrote a book called Uncompromising Truth for a Compromised World, which is a very good book if you're interested in how Buddhist thinking comes into the sort of political and economic aspects of the world. And he said that actually there was one person who Buddha would not teach. One man. And this man was the hungry man. And Buddha wouldn't give teaching to the hungry man because he said, first, take him away and feed him. You must feed him. And he must be satisfied. Only then, after that, will he be comfortable and then be able to come and listen to the teaching. So, when we look at where carers are working, very often carers are addressing hunger and poverty at different levels. They're working in what John, I think, very powerfully described as dukkha magnets. And that level of care is very demanding on the people who work there. And many people who work in medical work and other fields of work suffer from burnout and compassion fatigue. In fact, I was trying to find out what percentages this might be, so I Googled job stress by profession. And I just got pages of stress about stress for healthcare professionals. So it is a very highly stressed job. Burnout, as I'm sure you know, is a state of physical, emotional, and mental exhaustion. And it's marked physically. There's a physical depletion, there's chronic fatigue, and people feel helpless and hopeless. They don't feel able to do the work well. And they end up feeling bad about themselves, and they feel bad about the work, and they don't have any compassion. And that's when it sometimes gets called compassion fatigue. And compassion fatigue has been described as untreated burnout. And it's often the most conscientious staff who are vulnerable to burnout. It was found by the researchers who developed the MBCT that class, and I quote, class members were not just being exposed to a set of skills to be used at the first signs of stress, but were learning a more general mode of mind that was especially helpful in relating to different experiences. That was for the people coming to their classes, but of course this can be applied to staff as well as to patients. They too can learn different ways of dealing with stress. So when we look at meditation, is meditation something that can be learnt from a book? Meditation comes from a long oral tradition. It's literally been passed from ear to ear through lineages of teachers through thousands of years. So you can say at one level the instruction is a direct transmission. However, when books now, in our time, books are very much how knowledge is spread. And when, for instance, the Tibetan Book of Living and Dying was published, the meditation classes in our centres just went into huge numbers. And we had people, in some cases, some centres, queuing up down the road to get in, because people had read it in the book, but they needed to learn how to do it. So I think there's these two components. Yes, you can read about meditation. Yes, you can read about it in a book. But somewhere you need somebody to work your own understanding of it through with. You need some form of instruction with it. And one of the things that has happened through the work of Sogyal Rinpoche and the many centres that he's founded throughout the world is that we have introduced meditation through his work, through the instructors that he's created in the different centres, through the ongoing work there over 30 years, to thousands of people. And some of them may only ever come to one class, some may come, still be coming after 20 or 30 years, but they get to meet meditation. They get to begin to understand the jewels, the treasures in this amazing tradition. So why did people come to meditation? Some people came because it was a cool thing to do. Sort of, go to meditation, but they tended not to last for very long. More often people came because they were stressed, they needed, or they had some problem in their life. And I think it's been said before by some of our speakers, they didn't come when they were right in the height of their problem or their crisis. They came afterwards, or as it began to subside, because they wanted to find ways, to find methods in which they could deal with the problem, should it arise in the future, or with the still ongoingness of it. And maybe for some of you, that's why you came to meditation. I don't know, but maybe you can remember some things that brought you to meditation. I know we had, for instance, in a class in London, we had an artist who came, and he had lost everything. He went home one night, just after being out, like you normally do, and he lived on an island in the middle of the Thames. And he got back and he found that there'd been a fire and his whole house was burnt down. And because he was an artist and he worked at home, all his work was burnt and destroyed, and all his possessions. And of course he found that very difficult, so he also then lost his relationship. So he lost everything. But he didn't come right in the middle of that. He came some months afterwards to the meditation class to learn how to work with that sense of loss and complete change in his life. So we've probably forgotten now, because meditation is more widely understood, just how people did travel sometimes hours to go to classes in order to learn meditation. There was huge dedication where people had made a connection with these teachings and then were prepared to absolutely travel to do that. Now, how does this relate to staff at hospitals and staff in prisons? Well, some of these people who were doing this were actually people who worked in the health service, and they were finding that meditation was benefiting them, was changing their lives. Traditionally in Zen meditation, the teacher, before he gives the meditation teaching, actually gives a warning. I don't know if you know this or have heard this. And he says, or she says, don't come to this teaching, right at the beginning, don't come to this teaching unless you are prepared to change your life and stay. Because once you get this teaching, it will hook you. It will affect you. And this happened for many people through the classes, both in Rigpa and all the other Buddhist centers that were developing at that time. Meditation was becoming a hook that was getting hold of people. There was a young doctor, came to one of the classes, and he went working back amongst the staff, and they said, "What's happening? You're much more relaxed. You seem to be more relaxed." He said, "I can't tell them what I'm doing. They'd think I was bonkers if I said I was doing meditation." Because in those days, meditation and madness were not seen as completely separate, yeah? That's something else probably. I mean, it's wonderful now that you can say the word meditation and people know this is something sane. It used to be seen as indicative of the beginning of a whole host of problems if you went to meditation. So the spiritual care education program, which was developed after the publication of the Tibetan Book of Living and Dying, actually started to bring in the methods of meditation. We wanted, first of all, to emphasize that for people working as carers, they would benefit from having a simple daily meditation practice of their own. And secondly, that if they learnt some of the other practices in the Tibetan Book of Living and Dying, which were the compassion practices, this would help them in how they related to the people they were caring for. So some of us began to take these methods into organizational training, and I just wanted to share a little bit with you about that. First of all, we had to smuggle meditation in. We could not say the word. When we started, we couldn't say the word meditation because it created too much fear, actually. It seemed to generate fear. So we had to call it something else. We called it stress management. We called it inducing the relaxation response. We went home and looked up sort of books to give us ideas of terminologies and technologies that would actually enable us to bring these methods in, but without using the word meditation. So I started to do that in a large East London hospice. In fact, Ursula showed a picture of Dame Cecily Saunders. This was the hospice where Dame Cecily Saunders did her pain management, brought that in, her particular method of pain management, which was actually based on using morphine with people who were dying. And we started to bring in meditation techniques, what now you would probably call mindfulness techniques, with nurses. Nurses in the hospice felt often that they were very rushed in their work. They weren't able to spend time with dying patients. They also felt very unsupported in their work. There was a lot of emotional stress generated by what they were doing, which they weren't really supposed to have because it wasn't professional to feel grief when a patient died. And there were very few support groups at that time for staff, and in this particular hospice at that time there weren't any. So when a nurse was going through experiences of a patient dying again and again, different patients dying again and again, they just had to bottle up their feelings. And one of the results of this was they got very busy and they found it very difficult to slow down and just be with patients, be with themselves. So we started to show them some methods of doing that. And to talk about it, we had to talk about things like, the flight-fight response, stress, what causes stress, the effects of stress, in order then to show that these methods of just slowing down and sitting quietly by yourself might actually bring out a different response in yourself, which was called the relaxation response. So we showed a very simple method, which was actually from the teachings of Sogyal Rinpoche, called the 5-minute holiday. And this was that we were encouraging people who were busy that they could do 5 minutes of sitting quietly by themselves a day, focusing on their breath, and that this would make a difference. And they could either focus on their breath or look at an object, depending on what worked well for them. And we did encourage them to gradually extend it, but even 5 minutes a day was seen to be a way of beginning to open up the door to helping people to slow down and come more in touch with themselves. We also emphasized that they could keep this mindfulness going afterwards, that they could keep this meditation going. And for instance, we showed them ways they could do that by having a dot on their watch, so that every time they looked at their watch, they remembered that they could slow down and pause. And also another method was before you pick up a phone, just take a breath and slow down. So we began to show ways in which people could actually bring these methods into their work and actually become more mindful, more aware of themselves and, of course, how they were with other people. So the other second place that we did this was in a prison. There's a large prison in London called Pentonville Prison, which you may have heard of, which has 700 inmates. And again, we were invited there to work with staff. You maybe know, but for prison staff, it's a high-stress job. And actually, it's known, for instance, that a lot of prison staff, particularly those that have been in the service for a number of years, there's a high rate of heart illness, heart disease, and it particularly affects them after retirement. So they tend not to live so long after retirement. It's actually a feature of the service that's known. So we were invited to work with staff there, and they had decided to tackle this problem of the staff being very stressed by creating once a week a happy hour. Now, it wasn't called a happy hour, but I don't remember what the official title of it was. But the staff called it the happy hour. And as one of the they offered different things in this happy hour, but one of the things they offered was meditation. And so there was a self-selected group of 20 staff, which we went and worked with, and we did a group, and we introduced across 10 sessions, we introduced different methods of meditation, and also we provided a forum where they could discuss how they were finding that and how it helped, so that they could then develop that more for themselves. And that was actually a very successful program. And after we left, the prison officers themselves continued to do that. So I just wanted to show that there was ways in which we tried to take these methods into different, very stressful work situations, basically because they were found to be helpful, because people did find, the people who work in these situations, found that they became less stressed, more relaxed, more able to relate to their colleagues and to the other people in their workplace. One of the things also that we were encouraging people to find was that when we did this, they didn't just find that they felt more relaxed or their relationship with people was easier. They also found that something around the ability to feel empathy for others, to feel compassion for others grew. And that seemed to be a natural component of meditation. So I just wanted to finish now with a very brief contemplation with you, which is about how we can see someone as another you, seeing another as another you. So if you'd like to just take a moment to and just allow yourself to become present. Just feel yourself on the chair. And if it helps for you to close your eyes to do this, please do that. And first of all, I'd like you just to consider that we're all human, and that every human being is the same in that we all want to be happy, we all want contentment. And just imagine in front of you now that there's someone who you know who is suffering. Perhaps it's someone you care for. Could be someone in your family. Just someone who you know who has that suffering. Imagine them just sitting opposite you and just try to really bring them here right now. Just wish that this person was free of their suffering. And really look at them as being just another you. They have just the same sort of hopes and fears that you have. The same desire for happiness and same fear of suffering. They too feel angry at times, uncertain, fearful. In every way, the person facing you is just another you. Now, just imagine for a moment changing places with this person. And now just imagine them looking back at you. And you become this other person, looking back at yourself. As you become this other person, just try to imagine what they might be suffering, because now you are them, now you are suffering the same as them. And now through the eyes of this person, just look back at you, sitting facing opposite them. You, the carer. How do they see you as a carer? How might they see you as a carer? Now come back again. Return to your own body. Feel yourself here. This is a very simple compassion exercise we can do. We can do it very quickly before we go to be with someone who is suffering, before we go to care for someone. Just recall, this person is the same as me. This person is just another me. And if you like, you can even, for a few moments, put yourself in their shoes, swap places, become them, and see how the world is for them. So I've tried to show you a little bit about the richness of this tradition that we hold in Rigpa today and share some of its gems, a little bit of the meditation, a compassion practice that we've just done. Rinpoche just talked about the 3-year retreat. You saw the pictures on the up on the screen. And I'd just like to say that during that retreat, and in fact during all of our retreats, we have a very extended care system. And we're actually working very actively with therapists to address the sort of problem that I think came up with the panel today, didn't it? There was a sort of discussion about, how are Buddhism and therapy completely separate still? The answer is no, not in Rigpa. We're really working very hard to bring the two together. And we're actively doing it in our retreats. For instance, every person has a carer during retreat who they can talk to if they need to get some support with what's happening. In addition, we're actually developing a method called spiritual counseling, the intention of which is to bring together Western psychotherapeutic methods with Buddhist understanding, with the teachings of Dharma, as brought to us by teachers such as Sogyal Rinpoche and Sokni Rinpoche and Mingyur Rinpoche, and I think we have to say Jetsun Khandro as well now. So we are very actively trying to do that in Rigpa, and I think it's absolutely right to say this is something that we need to bring to the West. So thank you all very much for your attention.